Thank you very much. Are the slides up? Can you see those properly? Yep. Getting nodding heads. Okay, fantastic. Thank you and good afternoon, everyone. I'd just like to start by firstly thanking the organising committee for the opportunity to present this research on behalf of our research team led by the very wonderful Associate Professor Claire Palermo. And would also like to also acknowledge the traditional owners on the lands on which we're all joining this conference today, to pay my respects to the elders past, present and emerging. I'm speaking to you today from Mornington, down on the Mornington Peninsula in Victoria, on the traditional lands of the Burrarong people. So, the Health Professions Accreditation System has previously been positioned as a quality assurance process. It is designed to ensure that the higher education sector graduates competent health professional students with the skills necessary to not only meet patient needs, but also the evolving needs of the healthcare sector. However, there is currently really limited evidence to suggest that accreditation actually improves the quality of graduates, healthcare delivery and patient outcomes. So what remains unclear is how health professions accreditation supports the development of work-ready graduates, whose needs and interests are being prioritised by accreditation, and what problem is accreditation actually trying to solve and at what cost. So in this project, we explored the extent to which accreditation supports the development of work-ready graduates by putting a spotlight on staff experiences at Monash University. And we drew upon Yanau's interpretive policy analysis approach, which really focuses on the meanings of policies and the values and feelings expressed by those policies, and therefore how those meanings are communicated to various audiences or interpreted by various audiences. And this approach really provided an effective method for critically examining accreditation policy across multiple health professions. So we began by exploring current accreditation standards and process documentation related to all of the health professions programs offered by the Faculty of Medicine, Nursing and Health Sciences at Monash University, as well as other key health professions. And then we spoke with key staff members from these programs about their experiences of accreditation and drew upon framework analysis to analyse all of that documentation and interview data that we had collected. And so on this slide, you can see all of the health professions that were actually included in our research. So over on the right, in the pale blue, we can see all of those health professions that were included, or their documents only were included in our research. The middle, medium blue in the middle of the screen are those professions that are represented at Monash. And so we actually interviewed staff from all of those disciplines. And additionally, we interviewed staff from our quality assurance team in the faculty as well, as they're really key to our accreditation processes at Monash. So the needs and or interests of students and graduates were really prioritised by the accreditation process. So this related to their need to meet professional competency standards to be eligible for registration if that was relevant to their discipline, and also their needs in terms of the resources actually necessary throughout their program of study. Industry was also identified as a key priority to ensure that there was a minimum standard of practice achieved by our graduates. And finally, the needs of the public and community were also identified. So in terms of meeting their expectations, but also ensuring that our graduates were competent to ensure delivery of safe care to the public, and so in other words, be work ready. And accreditation was also positioned in the documentation and by our staff as aiming to address problems associated with poor quality of courses, underprepared graduates, unsafe health care provision, and also graduates being unprepared for our really evolving healthcare system and the evolving healthcare needs of our community. But there were a number of clear tensions also present within the accreditation system, such as power conflicts that were arising between accreditation panels and TEXA, competition between universities in terms of wanting to protect their innovative curriculum ideas and components and their reputations, and also some inflexibility by some accreditation bodies around input versus outcome-focused education, particularly during this very challenging COVID year where facilitation of things such as clinical placements has been particularly stressful for staff and student alike. So in terms of the costs actually associated with accreditation, meeting the needs of the accreditation process appeared to take an enormous amount of staff time associated with a lot of workload stress and funding to get right. So lots of time and cost was also associated with the actual site visits of accreditors coming out to the university, However, with many site visits actually starting to happen virtually this year as a result of COVID, the fiscal costs may change moving forward with a lot of professions. And our research really suggested that at Monash, our faculty really needs to consider investment in an accreditation officer who could sit within our quality team, who would understand all of the TEXA and external professional accreditation requirements for all of our different courses, to cut down on some of that staff time associated with trying to find lots of the policies and work out what they needed to do, as well as faculty and department repositories, as well as key policies. So moving forward, given the focus on accreditation is largely on input measures and the needs of students and graduates, we suggest a need to really advocate for more focus on outcomes-based education. And by considering improvements in supporting staff to assist accreditation and therefore understand accreditation processes, we feel that this will enable academics at Monash to really focus on other key elements of their roles, which is really to ensure that we truly are graduating evidence-informed work-ready graduates. Thank you.